Hi guys, welcome. I'm running a little bit late today. I have some technical issues, but today I want to share with you some cases I have and also my experience with fibroids. This is so as you know, uterine fibroids or myomas are the most common abnormal growth of the female reproductive organs. So here, about 20% of women over 35 years of age will experience or have this benign tumor. So uterine fibroids are the most common benign tumor of the female reproductive tract, and about 25% of all women of reproductive age and up to about 30 to 40% of women over age 40 will have this or have had this. It is estimated that 50% of fibroids are asymptomatic, means you don't know or you don't feel anything. They can happen on the inner or the outer wall of the uterus or anywhere in the pelvic cavity. They range in size from a small pea to large, the size of a cantaloupe sometimes. Some women have only one small fibroid, where others have several. I see some women with fibroids that have severe period pain, heavy bleeding, and fertility problems, and treat them using acupuncture and herbs. Fibroids on the back of the uterus wall can cause things like constipation, urinary tract difficulties, and heavy menstrual periods. And then, we also have larger fibroids that can cause pain with intercourse and pelvic pressure. If you're trying to get pregnant, fibroids can obstruct the uterine cavity or entrance into the uterus from the fallopian tubes. They can also block an embryo from implanting in the uterine wall. If you are pregnant and have fibroids, it may increase in size during pregnancy as hormones levels increase during pregnancy, causing pressure in the uterus, and in some cases, it can also cause premature labor. For women who are in the range of the 20 to 40, I would suggest getting a pelvic exam to detect the location and size. Usually the type of exam would be like ultrasound, sonohistography, which is a ultrasound using sterile salt water, and they put it into the uterus to see, MRI or hysteroscopy as well. Just as pregnancy hormones can cause a fibroid to grow, a lack of reproductive hormones can also cause it to shrink. Currently, Western or biomedicine treatments sometimes use drugs like Lupron to create the condition of pseudomenopause, meaning you go into menopause for a short time as the drugs lower estrogen. Estrogen feeds the fibroid, hence the drugs Lupron is used. So what happens if the fibroids are small? If the fibroid is small and is accessible from inside your uterus, a laparoscopic procedure can be done, meaning the surgeon will use a prop threaded through the cervix to destroy the fibroids using either heat or cold. Another technique is arterial embolization, where the blood vessels feeding the fibroids are cauterized. So this means they cut off the blood flow to the uterine lining, and I do not recommend this if you're trying to get pregnant. In more complicated cases, when the tumors are large or located on the outside of the uterus or in the pelvic cavity, a laparotomy may be needed. So this procedure involves an incision either through the abdominal wall or the uterus, and the healing time takes about 3 to 6 months. So keep in mind, if you're trying to get pregnant, this is a timeline for healing. In some cases of fibroids being too large or compromising to the woman's health, hysterectomy, which is the removal of the uterus, may be the last line of treatment. So hopefully we won't get there if possible. Shrinking fibroids the Eastern way, used in Chinese medicine, provide a far gentler and more effective remedies for fibroids. Like endometriosis, which we will cover hopefully in the next video, fibroids are considered lumpy, nodulation within the body. This causes the hardening of the blood, and we call this blood stagnation. So the treatment involves invigorating the blood and eliminating the blood stasis. The formula that is commonly used is the cinnamon twig and poria decoction, or we can also do the capsule form as well. One study that I would like to mention is this one. The 223 women with cases of uterine fibroids were treated using Chinese herbal medicine. All of them have measurable symptoms such as heavy period bleeding and diagnosed clinically by pelvic ultrasound. And the treatment involved here is invigorating blood and eliminating the blood stasis, move qi with clear heat, and soften the nodules. I want to make it clear what clearing heat means here. Usually with stagnation of blood and where the nodules are involved, it's like a little ball of fire. The accumulation of the mass causes friction and heat. So when we say clearing heat in Chinese medicine, we mean we want to clear the mass and the tight knit clump and try to clear and reduce the mass basically. So we use herbs and acupuncture to soften the nodule so that it can naturally shed. The Chinese herbal medicine used in the study also contained herbs to resolve blood stasis and to move qi. Additional herbs were also added based on each person's body constitution. Whether you have yin deficiency, means you have low estrogen, you have qi stagnation, or you have more heat, which diagnosed as contributing to the formation of the fibroids. So here we treat the root condition and the branch, like a tree basically. So the formula in the study was taken after each woman's period and in 3 to 6 months time. All of the period heavy blood flow, abnormal discharge, backache were improved or eliminated. The fibroids also reduced in size or disappeared in about 70% of the women in this study. I would also recommend acupuncture and acupressure in treating fibroids to help reduce blood stasis in the uterus. How acupuncture can help? Acupuncture helps to stimulate near the site of the growth to prevent more pathological growth of the cells. And I will post the link up here for the study so that you can read and look at the study. So here's a list of using Chinese medicine, and in self-care, you can do it at home. I would recommend wearing loose clothing when if possible, not tight jeans. And when you have your period, use pads instead of tampons. This helps with air circulation. During your period, apply castor oil packs on the abdomen to invigorate blood, assist in lymphatic movement as well, and helps to balance hormones. And avoid all foods that have been treated hormonally, such as hormone beef and all that. Reduce caffeine, reduce alcohol and dairy, and move. Regular, moderate exercise help to move qi. I would also include like cold pressed oils like flaxseed oil, pumpkin seeds, and chia seed oils. Avoid animal meats, dairy, eggs, and peanuts as they contain arachidonic acid. Eat only organic meat. Include also dietary spirulina and evening primrose oil. And food that are helpful to resolve blood stasis are like kelp, lemons, limes, and onions. If your period flow is clotty, of course, take the evening primrose oil, linseed oil, and fish oil. So I hope this has helped you and give you some recommendation on what you can do for yourself. And the study, I will put the link up in a little bit. So thank you for watching and see you next time. Bye for now.